Good evening, everyone. This is Steve Ward with docdoubt.org. Search for DocDoubt Official on YouTube, Instagram, and Facebook. Thanks very much for joining us this evening. Have an exciting program scheduled, and I'm thrilled that you're here. Remember to subscribe so you get continued content. Visit the website, docdoubt.org, and where you'll find more similar videos, blogs, and content, and you can join the community. Always feel free to reach out by email, and I'm happy to correspond with you. You'll notice in the chat, there's an opportunity to enter questions and comments in the chat. Would love to hear from you. We're coming at you live, and I'll present some content, and then we'll leave time at the end for your questions and comments. And let us know where you're watching us from. All right, well, with that, let's jump right in. So we've been talking over the past couple of broadcasts about LGBTQIA ideology. And recently we've talked about some of the postmodern and progressive elements that's behind that movement. And I also discussed some of the medical literature that's being used to support or to give the idea that we have many young people, especially, who have gender incongruence. And I pointed out some of the problems with some of that literature. So I'm hoping to continue some of that conversation here tonight. Good to see the Servant Slayer from El Salvador. Awesome that you were able to join. Thanks so much. Good to have you. Let's just take a moment and remember that we want to discuss this issue very carefully and with great compassion. This is a difficult, very controversial issue for many people. It's a hot button in our culture right now. And we want to make sure that we're always discussing this with respect and compassion towards people who may be struggling with this issue or have family and friends who are part of this movement. So my goal for tonight is to help present some information to you that you can use in conversations with those in your immediate circles that might have questions or concerns. Tonight, specifically, talking about the intersex. So this is the I in LGBTQIA. And I think we're more familiar with the LGBT, but what is I? What is an intersex individual? How is it defined? And what I want to do is take a look at some of the specific genetics and some of the medical syndromes that are often used as examples of gender fluidity, and just ask the broad question, is this really evidence of gender fluidity, or is there something else more biologically based going on that determines gender? So a lot to cover with that. So I'm going to just jump right in with a definition of intersex that you might hear out there. So born with sex or organs or chromosomes or hormones that are not binary. Okay, that's often a definition that you may hear. Now, this has some problems. So sex we know is binary, male or female, but organs or chromosomes or hormones, just by just general category, right? Those are not binary or non-binary things. Hormones are just hormones. They're molecules that have biological function. Chromosomes are chromosomes, a collection of genes that have genetic function. So in and of themselves, I don't feel that it's really accurate to say that chromosomes or hormones are binary or non-binary. Hormones, I mean, it's a general broad category. There are many examples that do a wide variety of things in the body. There's growth hormone, there's cortisol, there's insulin, renin, erythropoietin, adrenaline, aldosterone. Okay, so there are many. Testosterone and estrogen are just two. Those are what we widely know as the sex hormones, but there are many. And what a hormone does is will bind to the cell membrane of a cell and either be transported within the cell, or it will cause a cascade of chemical reactions that ultimately will cause the transcription of genes within the nucleus, the manufacture of new proteins, and launching a new process of activity within the cell. So hormones are metabolically active. They're cell signaling tools that are busy and active in every cell of the body, not just in the sex organs. So XY chromosomes, this is very notable, very important. Okay, one of my key takeaways for tonight. The X and Y chromosomes are active and present in every cell of the body, not just the sex organs. And that's really a key evidence or a support that helps us understand that gender is really biologic from head to toe in every cell of our body, not just limited to the sex organs or sexual development. And this is why changing hormone levels through pharmaceuticals or having a surgical procedure does not change your gender. You might change yourself in terms of your hormone levels or your physical makeup or appearance, but you are male or female in every cell of your body. And that's what I really want to try to get to in more detail today. So the intersex community will also lay out a claim that we don't know what gender a non-binary person will choose when they're older or who they will be attracted to. And I think this really illustrates that in this philosophy or ideology, the gender is considered something that you can choose and it's determined in your mind. But this is, my point tonight is to show you that this is incorrect, that your sex or your gender is determined biologically. And then there's also other issues with this being just a philosophical, ideological movement more so than something that is grounded within the biological sciences, such as genetics. To help explain this a little bit more, let me take a few minutes and just give you a broad overview of some genetic concepts that will be very helpful to you as we move forward. So, the Human Genome Project, this is going back quite a ways now, but this has really helped us to understand the role of genes, what they do in the body, how genes are transcribed, all of the molecular machinery that's involved in manufacturing new proteins and turning certain genes on and off. Those are super important concepts and a really busy, hot area of molecular research. Pharmaceuticals, for example, are now targeting specific genes or very specific molecules and processes within a cell. And that's a fabulous advance. So this gets very detailed. There are a lot of nuances. And my plan is not to get too bogged down in all of that tonight, but to give you an overview of some core concepts that will help you think through this intersex issue. So we can look at the sex chromosomes to see how sex is determined and what role the XY chromosomes play in determining our gender. So let's just launch right into that area. Now, humans have a total of 46 chromosomes, 23 pairs. Now, your XY, that's one of the pairs. So you have 22 other pairs. Your sex chromosomes, XY, is the other pair to make a total of 23 pairs in a human being. And this is important because all of those chromosomes, all of those pairs are present in all of the cells of your body, not just your sex organs. Keep that in mind. They're going to be very, very active in many metabolic processes, in all of the different organ systems of your body, not just involved in sexual development. So, how are the genes actually derived that come together to make a new human being at time of conception? So, like, how are the sperm and the egg actually made? So, there's a process called meiosis, which is important to know a little bit about. So, this is a method of cell division that is taking place within the ovaries or the testicles. Okay. So, you have a parent cell. The first step is to duplicate those chromosomes. And then there's a process where those, we call them sister chromatids, but those pair of chromosomes actually cross over. There's a binding process, a linkage that forms, and that allows the exchange of genes from one chromosome pair to the other to occur. So there's a swapping, there's exchange, there's just this generation of new variety that is taking place. Then there's a cell division that occurs. Those chromosomes are separated further, and then a second process of division occurs. So you go from one parent cell to a total of four. There are two divisions, so you have a total of four cells, but there's a new variety of genetic makeup that is present in each of those sperm or egg. So there's a few different steps going on in that process of meiosis. You first have a duplication of the DNA, and then you have a crossing over of genetic material, an exchange of genetic material, generating new variations, two sets of cell division, and so forth. Now, as you can imagine, there's a lot of molecular machinery that's involved in all of this that is happening. So you have to have functional transcription proteins that are involved. You have RNA, DNA involved. You have a separation of the DNA strands. You have the amino acids binding in the proper order according to the templates provided by the RNA transcription mechanisms. And the reason I say that is we just have to pause here for a moment and understand that if evolution was responsible for all of the complexities of cellular metabolism and cell division, you would have to have all of these functional parts operating perfectly all at the same time the first go around. Otherwise, the process of cell division and new development couldn't continue. We call this concept irreducible complexity. So that basically means that there's a huge amount of complexity involved, even at the most simple steps involved in something like cell division. And this is a great evidence for creation because an evolutionary model can't explain the incredible amount of complexity that's involved, even for the process of evolution to even get started. Okay, so just keep that in your back pocket as we talk a little bit further about intersex. So this process of meiosis or cell division has many different nuances, and that means that there's opportunity there. A lot of things could possibly go wrong. You can have genetic mutations, you can have error in the transcription, errors in the exchange of information, and we do see this happen in many instances that I'll raise to you tonight, but one of them is the formation of what we call a mosaic. So a mosaic is a cell, or I should say, it's a genetic condition where after a cell is beginning to divide, those sex chromosomes do not separate completely normally during this process of cell division. That's called non-disjunction. And during that process, you can have part of an X or part of a Y that actually goes into uh, one of the daughter cells that should not have that genetic material. Maybe it's going to be an X or a Y, but it might also have part of or a fragment of another X or another Y chromosome or some other errors that are involved. Now, this is super important because as cells divide, some of those cells are going to go on to form organ systems, your liver, your heart. Others will form your kidney, your spleen, the GI tract, the brain, and so forth. So there's this cell division, and the XY chromosomes that sometimes have this mosaic pattern of extra fragments or incorrect fragments will then be distributed into a whole wide variety of organ systems, not just the sex organs. So you can actually test for this. So if you take a sample of some of the various tissues throughout the body, you might find a slightly different composition of the XY chromosomes, depending on the tissue that you actually sample. So this is called mosaicism. And within the intersex community, a lot of proponents for LGBTQIA will say, well, this is evidence that gender is fluid and we can have a variety of genders, or we can be pangender or have any number of genders. But I want to try to help us understand that that's not the case. So, genetically speaking, the individual will be either boy or girl, but in other tissues, there's some activity of the X and Y, which is a little bit different or a little bit atypical, but that does not change the gender. Okay, so we'll get into that a little bit more. So, a lot can go wrong during the process of cell division. There are errors in the actual number of chromosomes, or there can be an error in the structure of those chromosomes. So let me give you a few examples. So one of the most common genetic abnormalities in girls is called 45X, which is Turner syndrome. And you may have heard of that. So these are girls who have lost part or all of one of their X chromosomes. So remember, a girl is XX, but a girl with Turner syndrome will have one X and then maybe a fraction of the second or not a second. But these are girls. So, structurally speaking, they have a uterus, they have ovaries, and often they're not even diagnosed until the girl is born as a baby and then grows through her first several years. And it's not until later, when the girl does not go correctly through progress through puberty in the classic stages, that this comes to attention that maybe something is going on, and there's some testing that gets done. And I want you to just understand that it's really the lack of progressing through puberty normally that calls this to attention. It's not a gender dysphoria that starts in the very early years, and it's not because it was unclear that this baby was born as a girl. This is a normal appearing girl, and as the girl grows and gets older, there are some abnormalities that are noticed, especially as there's abnormalities going through puberty. But in Turner syndrome, I want to point out and just make the broad case that there are many, many systems involved, not just sex organs. Now, Turner's is classic for infertility because the ovaries are not going to function normally. So you don't have estrogen levels that are normal. You don't have the ability to, have children. But there are many other things too. So, for example, there can be growth impairment. There can be a dramatic decrease in bone mineral density. The structure of the bone on the cellular level can also be abnormal. You can have cardiac problems like atrial septal defects, ventricular septal defects, aortic dissections, heart rhythm disturbances, hypertension, kidney malformations, urinary tract infections that are frequent, hearing loss, and even autoimmune disorders. There have been patients with Turner syndrome that have celiac disease or Crohn's or ulcerative colitis, thyroid problems that are autoimmune in basis, higher rates of cardiovascular disease and metabolic syndrome that could lead to diabetes and so forth. So there's a lot going on here, and here's my point. Not just to throw all of this information at you, but what I really want you to understand is that the XY chromosomes, they determine sex, but remember that the XY chromosomes are present in all cells of the body. So a patient with Turner syndrome that is lacking one of the X chromosomes is going to lack an X chromosome everywhere, and that's going to have effects in all of these varieties of organ systems, which is why we call it a syndrome. So this is not a different gender. This is a girl, but that has manifestations of genetic abnormalities in many other systems, not just the reproductive tract. So bear that in mind. And this is a great evidence helping us understand that the XY chromosomes are very busy everywhere. And your gender is more than just the external hardware, so to speak, okay, or your hormone levels alone, because you are a boy or a girl in every cell. And we can see that as we move on a little bit further. I'll give you some different examples. So what's the treatment for a patient with Turner syndrome? Well, we give estrogen or progestin supplements to compensate for what the ovaries are not able to manufacture on their own. And then we also give growth hormone as necessary. Okay, so Turner's is an example in a girl. Let me give you an example. Klinefelter syndrome is a syndrome that we see in boys. So this is an extra X, as opposed to Turner, which was a missing X in a girl. Klinefelter syndrome is an extra X in a boy. So in genetics, you would say this is a 47XXY. The extra X is from non-disjunction, okay, that occurred during meiosis. So, in other words, as the chromosomes crossed over, exchanged information, divided, there was a dragging or a pulling away of an extra X chromosome mistakenly into the daughter cell, which then became transmitted to the child. There can also be other mutations. So there are androgen receptor genes that can have mutations which cause a lack of testosterone sensitivity in various tissues. But this is not a new gender. So these are boys. And we know that because these are diagnosed much later as we get older and into puberty. Some patients with Klinefelter can even have children, and it's not known that there is an issue until patients with Klinefelter are much older. So what's the process here? So the extra X chromosome causes a fibrosis or a scarring of the parts of the male sex organs that produce the sperm, and also scarring in the cells that produce testosterone. So you have a markedly reduced sperm count as well as a markedly reduced testosterone level. But these are still genetically boys, but they're not able to be fertile, and we need to treat them appropriately. But again, these are boys, and the XXY will be widespread and present in all of the tissues. So, what are some of the syndromes? So, you can also have autoimmune, diseases. For example, you can have rheumatoid arthritis, lupus, diabetes again, some pulmonary problems such as COPD, cardiac issues, coronary disease, pulmonary embolism, mitral valve prolapse, varicose veins, in the bone, osteoporosis, some decreased muscle mass because of the lack of testosterone, and even cancer. So patients with Klinefelter may be more prone to lymphoma and breast cancer. Now, here's something that is helpful to know. So, an intersex individual, might say, "Well, a patient with Klinefelter, this is a new gender because, they might be born with the appearance of being male, but these patients can also develop larger breasts that look more female, and that could be a little bit confusing." And so there is truth to that. So some patients with Klinefelters will have breasts that are a little bit larger than average for a male. The reason is that there is androgen insensitivity in the breast tissue where the testosterone is not able to really stimulate those cells, but there are enzymes present that convert those androgens into estrogens, and then those local estrogens are causing the proliferation and the enlargement of the breast tissue. But these are still boys, okay? So this is not a new gender, but there can be that phenomenon. But just understanding what is going on and why is really the key. And as boys with Klinefelter get older and go through puberty and start to understand some of these things, what we notice is that they experience a relief when we explain, what is going on with this genetic syndrome and present treatments. They don't present with a gender dysphoria or a desire to transition, or this idea that they are multiple genders at the same time. Okay, so these are genetically boys. So, what's the treatment for Klinefelter? So we wait until puberty begins, and then we give testosterone in order to supplement what this individuals not able to manufacture on their own. And it's super important to wait until puberty because if you give testosterone too young, really to anybody, you will cause a premature closure of the growth plates, and that person will have very short stature. Okay, so we see a trend now in the culture where we're giving testosterone or hormone blockers to kids that are younger and younger into adolescence because we're trying to treat what we think is this gender dysphoria. But in fact, you have to be very careful about that because you can prematurely close their growth plates and prevent adequate growth. So we always wait for puberty to begin in treating patients with Klinefelter. And really the reason is simply because this is normal physiology. Like as we get older and start to go through puberty, we're growing along the way. Then we're manufacturing the higher levels of testosterone for male puberty. And that then we're turning off our growth because we've already grown, to be the height that we're going to be. So anything that deranges normal puberty or normal adolescent growth can be very problematic, and we should be staying away from that. So hopefully that's a little bit helpful. So those are examples of abnormalities in the number of sex chromosomes. So let me shift gears. I'll give you a couple more. So there's a rare syndrome. It's called XYY syndrome. So these are 47XYY. These are boys that are born with an extra Y chromosome. So XYY. The incidence of this is maybe 1 in 1,000 or so. So it's, fairly rare. But these boys will grow with some developmental delay. You can have intellectual problems. There can be autism spectrum, ADHD, and some other things that are going on. Again, because the Y chromosome is active in all of the cells of the body, including the brain and the neurologic systems, not just in the sex organs. There's also triple X, which is in girls. So that's a 47XXX. So these girls have an extra X chromosome. And these girls tend to do very well, but they can have premature ovarian failure at a young age. So that's really, I think, some examples of what happens when there's an abnormal number of X or Y chromosomes. To revisit mosaicism here for a moment. So let's talk about one of the more common examples. Um, 45X, 46XY. This is a mosaic. So remember mosaicism where you have non-disjunction. So you have tissues that have different XY composition in the various organs of the body. So if the child is born male, so XY develops as a male like normal, but maybe that boy grows to then have what we call incomplete masculinization, which basically means maybe there are some other differences or incomplete development in what we consider to be typical for males. So that would be like muscle mass or height, things of that nature, facial hair, things like that. So these are genetic males, these are boys, but they might have deficiencies in some of these other areas because of the mosaicism, where other tissues, other organs and cells of the body are reflecting more the 45X, which is the Turner type of phenotype. You can also have girls who are just born as girls with Turner syndrome, but some of the other cells within their body will be 46XY, but that's not defining them as a new gender. This is just talking about the variety of genetic variation in other tissues of the body that will be very busy in a wide range of processes in our cardiovascular health, our neurologic health, our bone health, and all of those other things. So again, not a new gender, but a complex interplay of what genes are doing everywhere from head to toe. Mosaicism, though, is super important to understand because some LGBTQIA advocates will say, well, what about children that are born with ambiguous genitalia? And this does happen. It's very rare, but there are cases where the genitalia are ambiguous and it's not clear, is this a boy or a girl at birth? So let's just be open and talk about this for a moment. So the sex organs in this case have not developed completely, but the other tissues of the body will be predominantly one gender or the other specifically. So these are not new genders. This is a genetic defect where the genitalia is not developing normally. Okay, but that doesn't mean that this is a new kind of a gender or that gender is fluid. This is a genetic defect. Okay, it's an exception from the rule. It doesn't change that there are two biologic genders. And if you let this play out over time, what we would see is the child will manifest the characteristics and the traits that really reflect what is going on in all of the other parts of the body as predominantly male or female. So in these instances, it's not wrong to watch and wait. The child will declare him or herself, so to speak, but it would be incorrect to say, let's wait and see what gender the child chooses, or as the child grows up, to change its gender or to consider itself gender fluid. That would be biologically incorrect. And likewise, it would not be appropriate to use hormone therapy or puberty blockers or surgery because that wouldn't change what's going on genetically with the child on a more molecular level that will play out itself in that person's life. So I hope that helps a little bit. So that's the number of chromosomes and mosaicism. And then we also have the X chromosome structural abnormalities. Okay, so you have an error or abnormalities in the number of chromosomes, and then you have abnormalities in the actual structure of the chromosomes themselves. So let's take a look at the X chromosome a little bit and consider duplications. So you can have, there are many, many examples of specific genes that are duplicated on the X chromosome. And this can happen in boys or in girls, right? Because girls are XX, boys are XY. So boys and girls both have an X chromosome, at least one. But on that X chromosome, you can have a duplication of certain genes. That causes really a wide variety of problems, but none of those duplications change the gender of the child. You're just going to have complications that are going to manifest in a variety of medical problems and challenges, but it's not a new gender. Okay, it's a duplication of a gene that's going to cause some interference in the metabolism and the normal uh, activity of the X chromosome. There is a condition that I would want to mention, though. This is on the region XP2122, and not important to memorize that or remember that. I'm just throwing out an example and giving you a little bit of information in case you want to read up on it on your own. But this is an XY boy, but there's a duplication in that particular region of the X chromosome. And what's really interesting here is that the duplication causes the production of certain proteins that will actually block the male development. And because of that, this baby will develop and be born as a female. Okay, so this is XY chromosome, which you would think is a boy, genetically speaking, and normally you would be correct. But in this case, the mutations of the X chromosome will actually turn off the Y, and then the baby is born as a girl. So that's not a different gender or gender fluidity, but this is an abnormality which effectively it inactivates the activity of the Y chromosome, and that's why the baby is born as a girl. There's a Y chromosome present, but it's turned off as a result of this mutation that's on the X. So I hope that makes a little bit of sense. So you can have duplications. You can also have deletions. So on the X chromosome, there's a long arm and a short arm. You can have a lot of deletions, especially along the short arm. That would be basically part of the X chromosome is deleted, but you still have the overall XX pattern or XY pattern. So these individuals are born as girls or as boys, not as a different gender or as a gender fluid situation, but just basically you have an X chromosome, but some of the genes that are on that X are missing, but you're still either XY as a boy or XX as a girl. This will affect many, many organ systems throughout the body, and that I think will just be further evidence that gender is something that is given to us at birth as we are designed by God to be. It's not something that we can change by deciding to be a different gender or by being administered hormone therapy or blockers or undergoing surgery. All right, so that's a lot of information. Let me pause there and let's take some questions and comments from the chat at this point. Let's see what we got going on. Looks like we got some comments here, so that's awesome. Let's see, I'm just trying to get up some of those question and comments. We are present from Colombia. Servant Slayer is asking, how dangerous is a hormone or blocker treatment? I read something about how a transgender girl had problems with her tissues. So yes, great question. Um, Hormone blockers are very, very dangerous, and the reason is that hormone blockers block puberty, and because your XY chromosomes or XX chromosomes are present and active in all cells of your body, you can't just block certain things without affecting others. So you might think you're taking a hormone blocker to prevent yourself from developing further as a boy or girl in terms of becoming more mature in your sexual organs, and that would be the outcome. But remember, you're also altering and blocking normal puberty in all of your other tissues, so you can have cognitive problems. Brain development is impaired, bone growth, your cardiovascular health, neurologic health, your GI health, all of the organ systems that are involved will be affected by hormone blockers. So you really shut down this person's entire development that would normally be age appropriate for them. So in an effort to just slow down or prevent the sexual maturation, you really shut down and block everything, which can really be catastrophic. So you have adolescents with osteoporosis. Um, I heard a comment by a physician who prescribes these hormone blockers that, well, if we, block puberty in girls, but then also give them testosterone to transition them to male, yes, we increase their rates of cardiovascular disease and other problems, but since those problems are more typical for males, then we can call that a success. We have helped them become a male. We have given them a male's problems, which I think is really an unethical way to take a look at this. But that's some of the philosophy that you'll encounter. But to answer your question, there can be widespread devastating consequences because you don't just shut down the sexual maturation, you shut down the activity all throughout the body. All right, great question. Let's see what else we got. From Daniela in Colombia, thanks for being here with us again. Can we say that what makes a woman is that she has XX chromosomes? Um, I would say in the wide variety of cases, yes, you can say that. but there are nuances. So, for example, the exception where you have the XP2122 uh, duplication basically is going to inactivate the Y chromosome, and then you'll be born and you'll, have a female sex organs, and you're born a girl. So in that case, you might not have the pure X chromosomes like a typical female would have, but you're born as a girl because the Y is turned off. So I would say it's very, very rare, but it wouldn't really be completely accurate to say that what defines a woman is the XX chromosomes, because you also have to discuss in more detail, well, XX chromosomes, yes, but in what tissues are you talking about? Like, are you just talking about the sex organs, or, what about, the female characteristics that involves brain development, cardiovascular development, all the other different organs that will lead to the emotional, psychological development of a girl and a woman, which is just as important in defining what a woman is. So I would say, don't worry about the extremely rare cases where that might not be true. So I would say generally, yes, it's okay to say that, but just be aware in the back of your mind that it could be a little bit more complicated. I hope that helps, Daniela, and it isn't a little bit too muddled. Feel free to chat in again if you have a follow up on that. Let's see what else we got coming in. All right. That might wrap up what we have coming in for questions in the chat group. All right, awesome. Well, those are great questions. Let me just, slow it down for a minute and wrap it up by saying that we just have to be careful how we discuss these issues, because um, people who are, biologically informed or genetically informed might throw at you examples of some of these, rare abnormalities, and try to suggest that gender is really fluid. But what I would say is, just kind of as a summary statement, is that you're going to have sexual organs that are obvious at birth, but even in the very rare instance where you have ambiguity, you will still have predominantly male or predominantly female characteristics in the other tissues that will manifest themselves as that child grows. That's really what I'm trying to get at. I did have a new question pop up. Looks like from Hotaru Kaleidos from Colombia as well, I believe. Awesome to have you. Thanks for coming. How true is it that the brain is gendered too? An XY born girl can be heterosexual, or is there a possibility to develop homosexuality and say its orientation is indeed a biological condition? Okay, awesome question. So the brain is gendered, and the reason is that there are X and Y chromosomes in every cell of your body, including in the brain, and the activity of those chromosomes will be different. So if you're a girl with XX in your brain, those XX chromosomes are going to develop you neurologically in a different manner than XY chromosomes will develop a boy neurologically. So the brain is absolutely gendered. Um, so the question of homosexuality is really, really important. So there is no gene that has been identified that causes homosexuality. So homosexuality, just like the other letters in LGBTQIA, so lesbian, gay, bisexual, transgender, intersex. So these are not biological genetic conditions. So these are uh, conditions that are choices of the mind, where a person, for any wide variety of reasons, will be attracted to the same gender, same sex. We would call that homosexual, or believe that they are truly the opposite gender, but in their current body incorrectly. That's the gender incongruence. But those are really more mental health disorders. There is not a biologic basis for them. So, with all of the research that has gone on up until this point, there has never been a gene that has explained homosexuality or transgenderism. And these examples tonight, I think, show that intersex conditions are really not intersex. They're specifically boys or girls that will have a variety of other problems in different organ systems, but they're still predominantly boys or girls. And then you have the lesbian, gay, bisexual community with same sex attraction, but that is also not biologically based. So, to answer your question, the brain is definitely gendered. A heterosexual girl, um, or a heterosexual boy would naturally be attracted to the opposite sex, but same sex attraction is something that is psychologically based. Hope that makes a little bit of sense. All right, I think we have come to the end of the questions for tonight. All right, Daniela just popped up. So, how would you define a woman? Well, a woman, I would say, is a girl who has grown to maturity is now a woman. So, I think of the question is, who is really born a girl? And that would be genetically an XX um, chromosomed individual. There may be genetic mutations, or like we saw some duplications or deletions or mosaicism, or even the absence of one of those, which will cause problems, but will still define that person who was born as a girl as a girl. So, a woman, I think, is simply a girl who grows through her life into adulthood, may or may not have reproductive capacity. So, for example, a girl with Turner syndrome will grow up to be a woman, but might be infertile because the ovaries are not able to produce the estrogens, and she's not normal able to have kids by normal means. So I think it's incorrect to say that a woman is somebody who can have kids, because there are many women who can't have kids. Maybe a woman has infertility for any number of other reasons. So I think we have to be careful by using the capacity for reproduction as a definition. So I would say that, a woman is a girl who goes through puberty and matures, and is manifesting the traits um, of a woman, if that makes any sense. So, Daniela puts in, do you know any studies that disprove the homosexual chromosome gene? No, I don't. So, I've looked through the research pretty carefully, so I know that there are not studies that have come up with a homosexual gene. That has not been discovered, I believe, because there is not one. And there's been a lot of effort to try to identify a homosexual gene, but that has been unsuccessful. So no, I don't know of any studies. Um, and I would say that's because we're not going to find that gene. There's, I think, a lot more going on here. All right, let's see if we have any other comments. All right. All right, one last question from Hotaru Kaleidos. Happy to answer it. Do you know if there is any literature that approaches intersex from a Christian perspective would be interesting to read? So no, I don't know any specific literature. One of my purposes for tonight is to try to, just explain that what an LGBTQIA um, advocate would say is intersex is really not intersex. It's genetic abnormalities that still have an explanation with individuals as either boy or girl. Okay, so I think from a Christian perspective, what I would say is simply that we live in a fallen world. And because of the consequences of sin, we know that death entered the world. So our physical bodies can be born with any number of diseased conditions because the world is fallen, right? So we all have mortality as a result of the curse. So we all have a shelf life, so to speak. So, the Bible talks about 70 to 80 years of a human lifespan. And what you're going to see is a wide variety of ways that people are born. Maybe some will die prematurely of cancer or any other types of problems. But even so, our bodies do decline with age. And the aging process also has a genetic basis. And to me, to be born with heart disease or a mental disorder or a liver disease, a lung disease, a cancer, any of these things, you can also have genetic abnormalities in the sex organs that's due to a problem with your sex chromosomes. So that makes sense that we see brokenness throughout the genetic structure, and we see that in a variety of ways in all disease conditions, including what we would call intersex. But I would just simply say that this is a result of the fallen world and the fallen condition that we find ourselves in. And we're going to see a wide array of problems. Hope that's helpful, Hotaro. Camilo, I have a question: how to answer to those who separate gender from biologic sex? Great question. So I think it's really important to first get to know that person and understand exactly what they mean by gender. So somebody who is in the LGBTQIA community will often say, well, gender, I can express my gender, or, I have a gender identity that might be different from my birth sex. Like, so you have your biologic sex, but then you have your gender identity, which may be different. So I would say you first have to understand what they mean by the word gender, um, because in the Christian worldview, your biologic sex determines your gender. You're either biologically a male or a female. That's your gender. So this is really a worldview or a philosophy where, despite your biologic sex, despite what gender your sex would indicate you are, you can choose a different gender anyway. And so that's where proponents of this ideology are trying to go. So that is really where the discussion lies. So I think to focus in on, well, what do you mean by gender? Or, ask them questions like, how do you, align yourself with your biologic sex? Do you think it's possible to change your gender? And what do you mean? And I think often what you're going to get is as a response is that you might be a biologically male or female, but you can choose to live your life or to express your gender in any form that you choose. Um, the problem with that is that you can't successfully transition, right? So you can never transition from a male to a female or a female to a male, um, in a true sense, because you're only one or the other and it's fixed. So even taking hormone therapy or puberty blockers or having surgery, that might change some of your outward characteristics, like a facial hair or a mastectomy, so you don't appear to be a woman with normal breasts. That it's an outward change. So I think that is really how you start to answer the question. So it's really the focus of that individual on the outward externals of what they're thinking a certain gender should look like, rather than focusing on the biologic reality. So the idea that you can change your clothes or your appearance or have surgery and then become the other gender is just not true. You're just looking a little bit more like the other gender, but that doesn't change who you really are biologically, including in all of the other organ systems like muscle tissue, heart, brain, lungs, bone, all of these things. You're either male or female. But I think that that's really where this discussion lies. It's in defining gender. Is gender outward to that person or is it inward? And how healthy is it really to be a given biologic sex, but to live as if you were a different gender? And what we see in the growing literature and medical evidence and some of the studies that are being done is that people who have underlying mental health issues that are predisposing them to exploring the LGBTQIA community don't get better when they transition. If you have surgery or hormone therapy or puberty blockers, and over time, those people are still at much higher rates of anxiety, depression, suicidality as they were beforehand. So really what we're seeing is the transition process does not help. And the reason is because there are underlying mental health issues that are really at play here. And that's what I think you can try to maybe get to that a little bit, try to see, why does this person think they're a different gender? Is there some motivation coming from the culture, some secondary benefits, or was there a trauma history? Like there can really be a lot going on, and it's complicated to tease out, but that's where I would start, Camilo. So hopefully that's helpful. Great questions tonight. Anybody with any final thoughts? All right. Awesome, guys. So let's wrap that up there. Hope you enjoyed the broadcast, and I know that's a lot of information. So just try to digest that a little bit, but let's keep it simple. Just remember that genetically speaking, someone who claims to be intersex is biologically male or female. There may be abnormalities to explore, but really, at the end of the day, those differences will be seen in other organ systems and tissues, and they're still male or female. All right, guys, signing off for tonight. We'll see you next time. Take care.